again, when I was a postdoc with Rita Valentino, we had this kind of discovery that the CRF receptor might bind proteins differently. And so we were really curious about the different types of signaling and intercellular events that were happening as a consequence of this receptor binding proteins differently. And so we used a mouse model where the mice overexpress CRF, this stress neuropeptide, corticotropin-releasing hormone. They overexpress it. And then what we did is we looked at a brain region called the cortex, where there's a lot of these CRF receptors. And we looked using a phosphoproteomic analysis to look at the proteins that were phosphorylated differently in males and females. So we could kind of gauge what different cellular processes were occurring when there's a lot of CRF. And so what you do is you get a lot of different proteins that are phosphorylated, and then you can feed them into a computer program that does like a pathway analysis. And so it'll tell you like what are these proteins related to in terms of pathways. And what was interesting is that in the females, we saw that a lot of pathways related to Alzheimer's disease were affected in this model of high levels of this stress neuropeptide CRF. So it seemed like there were these Alzheimer's pathways that were more activated in females, including things like the phosphorylation of tau, which is one of the risk factors, and changes in the amyloid beta. So then with a collaborator, from the Cernansky lab, Hong Dong, we looked at a mouse model of Alzheimer's, which is a triple transgenic mouse. So this mouse had the amyloid precursor protein in its brain and also had lots of CRF in its brain. So it had this like risk factor for Alzheimer's, and it had this high level of CRF in its brain. And what she did is she looked at the pathology that resulted in the male and female brains of these mice and found that the females had more of this amyloid beta plaque accumulation. So in our mouse model, we also saw these changes in this Alzheimer's related pathology. So it could be that this receptor sex difference in females, when they're under conditions of CRF hypersecretion, which may occur in extremely stressful states, biases them towards Alzheimer's related pathology. It's an early days of kind of putting this story together, but it was really interesting that the processes that seemed to be really affected in females were related to Alzheimer's disease. And of course, there's higher rates of Alzheimer's disease in women.